is where your lower limbs are going to attach. So we'll start talking about some of your largest bones. Bones of the lower limb provide framework for your thighs, your calves, your lower limb basically. Femur, biggest bone, largest bone in your body. So the femur here, large bone. Extends from the hip to the knee, longest. As far as your long bones go, it's the thickest long bone. So here's the head of your femur, and that's where it fits. This is going to fit into that acetabulum that's in the hip bone. So it fits into that cavity. And if you've seen the newest hip replacements, actually it's almost like plastic, and it looks so simple. It's just a little cavity like this, and then they actually make a round head to the hip, and they will drill that into the bone of your femur, which to me sounds horribly painful. But then they just take it and it pops into this little plastic joint, and that's basically what they do for hip replacement. And then your ligaments and tendons will hold it in place. But it looks so simple. It's just a very, a very simple, the procedure is not simple, but the apparatus itself is very simple. Medial and lateral condyles. So we're going to have condyles on each side of the bone. Fovea capitis, the neck, greater, lesser trochanters. We won't talk about those as much. Patella, you definitely need to know. Patella is your knee, your kneecap, your knee bone. And it, remember, is sesamoid. It's not jointed. There's not a joint that holds it on your body. It is held there by tendons and ligaments that are going to go over the knee, specifically tendons.
Can you cut your kneecap off?
Could you?
You could. Yes.
I've never heard of it, but yeah, it could be. Many people will dislocate their kneecap, or they'll bump it.
With it or no?
Yeah, you could. Yeah.
Okay.
So, picture fovea capitis is a little opening for nerves and things like that. The neck is basically just the part right here. Greater trochanter sits up high, lesser trochanter sits down low. Your condyles, I do want to talk about condyles. So if I'm looking at this leg, this would be my right leg. So lateral means outside, medial means middle. So if I'm looking at this would be my lateral condyle because it's on the outside. This would be my medial condyle because it's on the inside. And they sit on the back of your femur. The epicondyles are going to be on the front. So this will be my lateral epicondyle. Lateral condyle is on the back side. Medial epicondyle, medial condyle sits on the back. So that's how you need to know what's the front and what's the back. So if I look at my femur, the head of the femur is the midline side. So here's the head, this is medial. Here's the head, this is medial. Tibia. Tibia is your shin bone then. It's the large, very pointed. You can feel your shin bone on your leg. Supports the weight of the body, articulates with the femur, and the talus of the ankle. That is one foot bone I'll want you to know. Anterior tibial tuberosity is where your patellar ligament attaches which helps with holding your patella in place. Medial malleolus is on your tibia. So we're going to talk about medial malleolus and lateral malleolus. So if I have my foot, you have ankle bones that stick out to the side. I don't know exactly how. So if I put my foot up, if you feel your ankle, lateral's outside, medial's inside. So your outer ankle bone is your lateral malleolus, inside medial malleolus. So if I actually look, my medial malleolus is on my tibia. My lateral malleolus is on my fibula, because your fibula comes more to the outside.
They feel the same.
They do feel the same. So your malleolus are your two little bumps, or the bone parts of your ankle. So the fibula then is the smaller bone on the bottom of your leg. Much, much thinner than your tibia. And I said in college we learned it, tibia, bigger bone, smaller word. Tibia, fibula. So the one interesting thing about the fibula, it does not bear any weight. If you break your fibula bone,
You could still walk.
yeah, you can still walk because it does not bear weight. However, it sometimes makes it harder to heal because of that fact also. So features, the head is just the top of it. And then the lateral malleolus, I do want you to know that. Lateral is on the fibula. So there's a picture diagram, pretty much shows what we've already talked about. Do note on the shin bone on your tibia, medial condyle is also on the inside. Lateral condyle is on the outside. They are the knobs at the top of your tibia. And that's probably about it with those two. When we get down to your foot, it'll be the same as your hand. There's 7 tarsal bones. I want you to know that you have tarsal ankle bones. We won't memorize all of the tiny bones in the ankle. The talus and calcaneus are the two I want you to know. So if I look at my foot area, the calcaneus is your heel bone. So it is a big bone in your foot. Calcaneus is your heel bone. Very important for supporting weight. The talus is this middle bone, and the talus is basically the connective bone between your leg bones and the rest of your foot. So the talus articulates, it joins your tibia and fibula with the rest of your foot. So calcaneus, heel, talus is that other large bone where they join. Yes.
So
Is your calcaneus the bone that's connected to your Achilles tendon?
Yes, it is attached to your Achilles tendon will attach down to your calcaneus.
when people lose their feet, what do they cut off just that part?
It depends, like when they have their, like for diabetes or something like that, when they have their
Sure, why not?
limb removed. Yeah, it depends on. It completely depends on. Sometimes if it deals with infection, yeah, they might remove that part down there. But they can also, they can cut a bone, which sounds very painful, but they can cut through a bone. Actually, when we get to the joints, well, even, like I said, with hip surgery, they just take a drill and they drill right inside of that bone and basically screw a knob to make the head of the hip bone. If you blow out your knee and have, like ACL surgery, they use a drill. My oldest daughter, Logan, had that, and I have the video. I mean, it looks disgusting. They just take a drill, and you can see, some of the ligament just flopping around as they go in to fix it. They use real tools. They use saws, they use drills and things like that when they're working with your bones. So yeah, it's kind of not a lot of fun to watch. Metatarsal bones then are the long bones of your foot, and this poor guy has fixed his toe a little bit. But your metatarsal bones are these long bones right here, and then here your toes are phalanges again. And if I look, your big toe has only two, so a distal phalanx and a proximal phalanx. The rest of your toes, even your pinky toes, have a distal, a middle, and a proximal phalanx. So your big toe is kind of like your thumb. It only has two bones to it instead of three.
Never noticed that.
Yep. So here, like in college, if you take an in-depth anatomy class, you may need to learn all of the little foot bones, but for my class, I do not require that. Phalanges are at the end, metatarsals are the long. Here's your calcaneus and there's your talus. Those two you should know. And here's a picture from the top. Do note, this is your first metatarsal, second, third, fourth. So as I look, my big toe, starting from the middle, my big toe is my first, second. Your pinky toe is your fifth phalange, or your fifth digit. And that's all of your lower limbs. Next time we'll do a little bit with joints.